Hello, welcome to Oral Health Talks. Today we'll be discussing the topic Oral Health in Unani Medicine, both therapeutic and preventive measures. I'm Dr. Rayeeha Zaman, who's completed Bachelor of Unani Medicine and Surgery from Government Unani Medical College, Chennai. Unani system of medicine is a traditional system of medicine that originates from ancient Greece, refined by scholars from around the world, especially Arabian and Persian. Hence, it's widely known as Greco-Arabian medicine. Oral health is vital to quality of life as it reflects the social and physical well-being of the individual and community. Poor oral hygiene predisposes to a lot of oral diseases that tops the common diseases affecting the human beings, causing continual public health problems globally. Unani principle in oral health. Any disease state is caused by the imbalance of mizaj in a particular individual or a particular organ. The mizaj is altered by digestion, the diet, and the humoral balance. The four humors present in the body are dam, that's blood, balgham, that's phlegm, safra, the yellow bile, soda, the black bile. These are the byproducts of one single humor called khilt, which is synthesized in liver. Sauda is a burnt version of yellow bile, and the diseases caused by the increase or imbalance of sauda are difficult to be treated and hence they enter the chronic stages. Mizaj can be explained as the quality or the increased expressive quality of a compound. Every matter that occupies space on the earth possesses its own mizaj. The four simple mizajes are har, barid, ratab, and yabis, which is hot, cold, moist, and dry, respectively. The combination of these mizajes har ratab, har yabis, barid ratab, and barid yabis are always present in every human being, every food, every matter, of which the most expressive form of mizaj is the normal constituent mizaj of that compound. Digestion depends on the diet, which in turn depends on the temperament of the food we consume. Any alterations to the mizaj of oral cavity or any other organ contributes to its disease. And the normal mizaj of buccal cavity is barid, that's cold. Orofacial diseases that can be managed by Unani medicine are dental caries, periodontal diseases involving gums, halitosis, bad breath, dental abscess, stomatitis, mouth ulcers, oral infection, dental anxiety, premalignant lesions, healing of wounds, dentalgia, pain. Dental anxiety is not much talked about, but it is a major cause for worsening of the already present dental problems in an individual. They are scared of injections or drills or the procedure in general, and hence they avoid themselves to go and get treated. Forms and modes of administering Unani crude or compound drugs. The most common modes of administering any drugs are oral, parenteral, rectal, and topical. The forms in which these drugs can be given to a person are the following: miswak, twig brushing, sanoon, tooth powder, gargara, gargling, mazoor, chewing tablets, mazmaza, mouthwash, safoof, powders for wound, manjan, strengthening powders which can be made into a paste in use, and then dental fillings. Twig brushing can be done with the bark or branches of miswak tree, or even neem tree can be used for these purposes. The gargling and the mouthwash, gargara and mazmaza, are done with by using the decoction of the drugs which will be mentioned later. The most commonly used Unani drugs in dentistry are asgandh, which is having properties of adaptogenic and anti-stress, and that calms the patients who have dental anxiety. Akhir khara, analgesic, anti-inflammatory, sialagogue. Sialagogue is a substance that has a property of increasing the secretion of saliva. Hence, it's used in people who have dry mouth or difficulty in swallowing due to less production of saliva. It's given in toothache, dental caries, pyorrhea, flaccidity of tongue, and stammering of speech. Babool. It has antibacterial properties, wound healing, desiccant, and hemostatic. Hemostatic, hence, it's used in bleeding gums. Desiccant is a function in which the area surrounding the medicine or the use of medicine causes the dryness of the area, dry enough so that microbial growth is not possible in the place. Hence, it's used in dental plaque, stomatitis, and cleansing. Goulet sur rose. It has astringent properties and antibacterial. Astringent property means it has function of constricting the vessels, so it lessens the chances of getting edematous, hence used in gingival diseases. Gile Armani, it's a mineral origin drug, Armenian bowl. It has properties of astringency, anti-ulcer and antiseptic. That's why it's used in excessive secretion or drooling of saliva during night, at sleep, septic ulcers of mouth. Haldi. Haldi is very much used as antibiotic and antioxidant, as you all know. But the active component in haldi, turmeric is, inhibits and suppresses the metastasis of melanomal cells and deactivates the carcinogens present in tobacco. Heel khurt, antibiotic used in oral infection. Tabashir. Any person who has ever used Unani medicine for any reasons would obviously know tabashir because it's very famous to be used in mouth ulcer. The compound drug safufe tabashir is used as a pinch. A pinch of powder is kept on the area of the mouth ulcer along the edges in the mucosa, and it's used for 3 consecutive days, which causes healing of the ulcer without pain and inflammation. Hence, it's used in stomatitis, inflammatory conditions, and bleeding gums. Khulzam is a compound liquid formulation used for gargling and for mouth washing. It has antibacterial properties, analgesic, and is a very good immunomodulator. Khulanjan has antimicrobial properties, bacterial, fungal, and protozoal, anti-allergic, anti-tumor, and anti-ulcer, used in infection, cancers, and halitosis. Mariam Goli is an antibiotic and antihydrotic astringent, which keeps the area dry, which does not help the growth of microbes, hence used in purulent diseases, used in the form of gargle, but because it's an anti-lactative, it's not given in postpartum women. Miswak. The chewing of miswak bark causes demineralization of the enamel, and that in turn promotes remineralization and hence keeps the teeth strong. It's an analgesic used in dental hypersensitivity, halitosis, caries, and is good for oral health and hygiene. It's like brushing your teeth. Murmaki is an analgesic, antimicrobial, anti-cancer, and astringent used in gingivitis, halitosis, soreness, swelling, loose teeth, and chapped lips. Neem, as you all know, is very good for prevention of any disease. Analgesic, antibiotic, antiviral, immunomodulatory functions. It's used in plague, gingivitis, dental caries, and in preventive measures. Neem bark, neem leaves, flower, or fruit in any form can be used in decoction and can be used as gargling or mouthwashing agent. Kharanfil is clove, very famous again, clove oil, chewing clove, etc. It's good sedative, anti-inflammatory, and antispasmodic, used for toothaches, gingivitis, halitosis, sepsis, and stomatitis. Shabe-Imani again is a mineral origin drug. It is potash alum basically. It has antiseptic, astringent properties and strengthens gums and teeth. It's used in inflammatory condition of gums, stomatitis, and bleeding gums. The dental filling materials in Unani medicine have these 3 properties in common: antimicrobial, astringents, and immunomodulatory. All these medicines are good analgesics as well. Mastagi is a resin which is used to bind any of these or a compound of these medicines to be used as dental filling. The, the mixtured product has a color of dental ceramic. That's why it's widely used to bind the other medicines. The common dental fillings are akhir kharha, afyun, that's opium, post tekebr, kalonji, naushadar, kafur, and filfilesia. After using these dental fillings, a person is advised to rinse their mouth with either rose water or vinegar. Preventive measures in Unani medicine: oral hygiene is obviously regular use of miswak, that's like brushing your teeth, and tooth powders for cleansing. Balanced diet, avoiding usage of temperament altering foods for prolonged time, and sugars. Detoxification by kutki prevents oral ulcers. Lesson, that's garlic. Chewing chopped garlic for 5 minutes sterilizes the oral cavity because it has antibacterial properties. Neem reduces plaque formation. And rose oil mixed with vinegar gargling also reduces oral infections. In conclusion, an attempt should be made to integrate these traditional knowledge of medical systems with conventional dental practice. For this incorporation of active ingredients of herbal plants into oral healthcare and practices are advised. Similarly, dentists should be encouraged and trained to use these natural remedies in a proper scientific way. These efforts will help in making dentistry much affordable, safer, and more accessible for lower socioeconomic groups in the society. Thank you for joining me today in Oral Health Talks. Signing off.